So on May 19, we conceptualized this program as the WRC to say that, look, this is a strategic contribution that the Water Research Commission can make at a national level by stimulating our own science communities and practitioners to coming up with this solutions around establishing a national wastewater and water quality, and we added water quality surveillance program for COVID-19. Okay, and in that the key objective, as I mentioned, is that we live in a dichotomy. You know, our urban centers are made up of you know, centers that are first world developed, and centers that are also you know, very developing and informal, with a lot of migration, etc. So we could see how this storm was going to transition, and the kind of readiness and preparedness that we had to be in. So for us, the COVID surveillance was always going to be a complementary solution in aiding government's initiative around individual testing, etc., and offer that early warning system around where we would start seeing through the trends, hotspots, and emergence of higher number of cases. So we didn't question really the science, because, you know, wastewater-based surveillance has been there for some time. We've been doing polio, we've been doing hepatitis, we've been doing many, many things at a national level. So it formed the basis and the benchmark to launch this program, okay, and set the kind of the infrastructure and the institutional platform that we required. So, you know, what we did is that we needed to be very strategic on how we engage this at a national level. So we established a stage gate approach, or we called a phase approach, and we divided our initiative into 3 phases. And the first was to do a proof of concept, okay? And that is very important for us. So the 3 phases was start the proof of concept, organize for a large-scale demonstrator or pilot, where we could then start feeding the national systems with good information and data around the hotspots and the trends, and then work with government of scaling this up right throughout the country. So we have about 896 municipalities. You know, it was always envisaged that the key hotspots are going to be the urban centers because of the densities. But the bigger concern was the rural areas that are devoid of very good health systems. And if we had greater exposures and cases in rural areas, the battle would be much difficult. So our objective is to try to get to a point where we're able to be sweeping the whole country in this whole surveillance-based program. So like I mentioned, the 3 steps is sort of where we are at. We about deep into the proof of concept. My colleague Nonhlanhla Kalebaila will now share with you some of the nitty-gritties coming out of it, and it looks very exciting in terms of what we can contribute to the global sector around our own experiences and the kind of innovations we're making in this space. Thank you. Nonhlanhla, up to you.
One of the things I was hoping to learn was who are the role players in the program, and also how it does fit in with the global stage of the rest of the world, things like the Sentinel Cities Monitoring Program in Europe, and so on and so forth. So yeah, great. Nonhlanhla.
Nonhlanhla will cover that.
All right. Hi, everyone. My name is Nonhlanhla Kalebaila. I'm also from the Water Research Commission. So right now we are working with a number of partners. So one of the biggest partners are the municipalities themselves, and then a number of researchers from around the country, University of Pretoria, water lab, and also other laboratories that are around the country, and also researchers who are helping us and to also take the samples from municipalities to the labs that do the analysis. So far, we've already kick-started with the phase 1 of the national program, which really is a proof of concept study. So in the proof of concept study, the whole aim was to really test the feasibility of implementing a full-scale program. So from the results that we have so far, which are basically from samples that have been taken over a couple of weeks in a number of hotspot areas around the country, so we have consistently detected a viral RNA in all the samples that have been taken so far. And we've also started doing some trends using the results that have been obtained. And we're already seeing some increases, which coincides nicely with the peak period that we are in.
Okay. Has there been any, is there any scope to extend the program into the, I don't know what the opposite of hotspot is, the cool areas of the country?
So let me come in.
Oh, yes. So,
Nons, you're doing that.
Yes, Jay. Yes, go ahead, Jay.
So you know, the proof of concept has created a very great narrative in the South African concept, in the South African environment. And what's been very useful is that we've been able to harness the interest and the expertise of the private sector, as well as several academic institutions, the large metros, science councils, etc. So we have now, through this initiative, created a great impetus for collaboration, and we call it the partnerships network around tackling this COVID-19 pandemic. So, you know, what it is doing is that together with our own initiatives, it's offering a body of new scientific-based findings, new learnings, greater data input into the trend analysis, etc. So, you know, there's about close to 15 collaborative initiatives that are happening around the country, and most of them tackling issues in hotspots. And we're beginning to see, you know, very, very good signals of the viral RNAs in all of the people's tests to date at different centers in the country. Our own initiatives are targeting 3 metro areas, okay, of Durban, Cape Town, and Ekurhuleni and Tshwane. And that is already showing us the picture on what was predicted in terms of the growing storm. And I think we're heading into the eye of the storm, and our initiative is quite timely in terms of complementing and supporting what will become a challenging environment very, very soon. And we're hoping that this pilot initiative and the proof of concept would accelerate us in much faster into a national program. The second part to our own objective is that we're seeing this national surveillance program as a leverage to a longer term surveillance program for the country on a whole range of other emerging contaminants and pathogens. So, you know, the objective is using COVID-19 as the spiral towards institutionalizing a longer term surveillance initiative in the country. Nonhlanhla?
All right, thanks, Jay, for that. And so these results are very important in supporting government initiatives. As you know, that the initiative right now is mainly based on individual testing. So the point that you raised, that I mean, the focus is really on testing people. So for those areas where really there's no testing, that's where the program becomes handy, because I mean, for as long as that community is connected to the wastewater treatment works, then we can take samples there, and then we'll be able to alert the government either to impose some public health interventions in order to slow down the spread of the virus. This is also important for the wastewater treatment works themselves, because now they'll have an understanding of the viral load that is coming into their works. So unlike maybe in some of the results that we've seen in the literature that, say in Europe, the wastewater treatment works are able to remove the virus such that it's not detected in the final effluent. But in South Africa, this information will be very helpful, because then it will also alert municipalities to make sure also to optimize their treatment processes so that they can make sure that all other microbial pathogens are also removed in the wastewater. The results are also important for communities as well. So if you're in a close community as well, because I mean, if you're also still connected to one central point, then you'll be able to also manage the spread of the disease, and also just for creating that awareness on the spread or on the rise of the cases in the country.
So to add to what Nonhlanhla is saying is that one of the concerns has always been around costs and the issue of costs to do this national surveillance, and I think it's a global concern. Where countries are smaller, the challenges are different. South Africa is quite a large, diverse, in some areas sparsely populated. So the logistics of doing this adds to the complexities of the costs, etc. A part of the proof of concept and the collaboration is resulting in us converging to low-cost techniques and processes and logistics management around how we can ship samples and what new innovations and what new techniques can be used to minimize the costs, okay, on each sample testing. We're coming to that scientific agreement and convergence around some very practical techniques and approaches that have been used on other surveillance regimes, etc., that have started to have resonance in where we finding good CT values from the techniques that are being used. So, one of them is a simple skim milk technique, but then also there's a new CG instrument that has come on the market that can reduce the labor time, by 60%. So there's all these new novel ideas that are emerging from this exercise that is positioning us to move to the next phase. So we are at the moment working with our national partners around organizing for this next phase of a countrywide pilot, where we would have a longer term monitoring program that is much more organized, that covers much more centers around the country, especially the hotspot centers, that can start feeding into, directly into providing this early warning at a time when we're getting into the peak of this pandemic. Okay, that then gets government in preparedness to say, this is where they should be focusing a lot of the energies in terms of individual testing and interventions. So that's next for the program. That's quite immediate. And like I said, it's an iterative process of learning by doing. So as we fix ourselves into the next phase, it's organizers for us to get to the ultimate phase of a national-wide surveillance program. What we're learning, and I'd like to share with many people around the world, and I think it's also some lessons we pick up from the experiences from Spain, that this is not an accurate system. It's just an indicator. It's there to complement, the individual testing. It gives you approximate answers to give you greater preparedness and response to this pandemic. Okay, we have to come to the agreement that it's not an accurate process, but it's important to recognize that the fact that we are mastering the art of recognizing the RNA through all these various techniques gives us that advantage in doing the trend analysis and hopefully more intelligence analysis going forward around how the disease will pan out. But it also sends or positions us to increase and improve our communications in those communities around safe distancing, around using masks, around hygienic hand washing and those kind of stuff, so that we can minimize the increase in the cases in those areas.
And I'd like to pick up on the comment you made about the RNA testing not being a finely tuned instrument, at least not yet, and relate it back to Nonhlanhla's observation that we don't yet know whether or not the infected virions persist through the wastewater treatment process, and therefore how to link the amount of RNA that we detect with the amount of public health risk, because you've both made that point. What do you foresee needs to be done in terms of filling in the data gaps so that we can draw that mathematical relationship out in the future and use it as a risk assessment tool?
So just the important learning, that if you want to do this, to relate the RNA results you're getting to the amount of people infected in a community, in the population, is a little bit of a challenge and an expensive exercise, because you'll have to do regular shedding studies around, how much of RNA is being shed by individuals at different seasons and different times, etc. And I think by the time you get to that, it starts becoming really expensive and you lose the opportunity. So the advice is that keep it simple, keep it practical, and use the best knowledge that makes the biggest impact. And this is what we're seeing, that the trend analysis and the early warning are more cost-effective measures in complementing the other national initiatives around individual testing.
Okay. All right, then just to round off, this webinar is potentially going to be watched by about 800 people from 60 odd countries around the world. Is there a take-home message that you want to give to them as members of the Action Platform along with you? Is there information that you would like to ask the wider community to contribute to the Water Research Commission? Or is there something that you want to offer them, and particularly people in the other countries doing similar programs to this one?
So just to say that we see ourselves as part of the global knowledge pool, so we will make this available to everyone globally. I don't think we're going to lock any information in South Africa, and that's why we're part of the Global Water Research Coalition. But we also participating as a WRC through the IWA specialist group that has been created around COVID monitoring, and we're feeding our own experiences and information through those platforms. There's one more unique proposition we're investigating that has global resonance. While everyone that are doing these initiatives is focusing on wastewater surveillance, we also looking at non-sewage environments as a strategic element, because we see that it has great benefit for South Africa as a whole, because we have many communities that are off the grid, and that is a gap in our system of how do we monitor many of the poorer areas that are off the grid in terms of this benefit surveillance bring. But there's many other developing countries like India, like many Southeast Asian countries that do not have wastewater treatment plants and do not have good drainage, even in Africa, etc. So I think it becomes a responsibility for us to tackle that area as well. And I encourage many of the people in the developing world to also lend a hand in this area, okay, while they're building their expertise on the wastewater side. I think the parting message is that let's not get locked into too much of research. The need is now. We should drive this initiative scientifically, yes, but also have this open mind by learning by doing, because collectively, if we create this momentum by involving more partners, more players, more scientists in this space, we will be able to reach this solution much faster. And we're beginning to see that because we have the private sector in South Africa participating in the big way. But it's also opening up a whole new economy, in a very suppressed economy. So there's a lot of good things that come out of surveillance as well. Thank you.
Okay, thank you very much. Nonhlanhla, any last comments you would like to add, or are you covered?
Yeah, probably maybe just to add to say that we also run regular webinars to share the information, and really so that whoever still starting out, they can maybe not repeat some of the mistakes that we made, but can maybe take on from some of the lessons that we are sharing. And also, we are also available to assist in the setting up of a program, especially in Africa. As Jay has said, that we're also focusing on the non-surveillance part. So yeah, that's all. But yeah, okay. Jay has all covered everything.
And
perfect.
We have
who should somebody contact if they want to get in touch with you?
So we have a wonderful website we've established at the WRC. It's a hyperlink on our website called COVID-19. It's full of resources, information, and all the webinars and the seminar information and presentations are available. It also has the list of people, within the WRC team contributing. So, we're much wider. This is a collective attempt in dealing with this program, and people can contact us. All the details are on the website.
That's great. Thank you very much. And for anyone in the audience who doesn't know, the website is www.wrc.org.za. Guys, thank you very much. Much appreciated. And we will talk soon.
Thank you very much, Joe. Been a privilege. Thank you to the audience as well.
Thanks to you for the opportunity to share.